What is the effect of insulin on blood glucose level? Insulin have a hypoglycemic effect, that is reducing the blood glucose level, and this effect of insulin is produced by increasing the permeability of the body cells for glucose.
Increase the
Permeability.
permeability.
So insulin, it reacts with the receptors found on the cell surface, and this hormone receptor complex later on changes the permeability of this cell for glucose, and so glucose start getting inside the cell. Normally, this glucose entry in the cell is dependent on presence of insulin, and therefore a rise in blood glucose or hyperglycemia is the most important stimulating factor for the release of insulin. This insulin, it is secreted by the beta cells of pancreas. Now, whenever we take some food and the blood glucose level rises, secretion of the insulin will take place in two stages. First stage or first step will be that as soon as the hyperglycemia develops, there will be an increased secretion of insulin take place, like this. But this increase in the insulin secretion, after some time, it start decreasing and come to a lower level after some time. But then after a gap of about 10-15 minutes, there will be a second rise in the insulin occur, which will be more stronger, and it sustain till the blood glucose come back to the normal. So the second rise, it will be stronger than the first one, and it will continue till that time that the blood glucose will come back to the baseline. Then the insulin secretion will also come down. Now, why this insulin secretion take place in two phases? That first an increase followed by a reduction, and then again a second rise. Why this pattern? Why insulin secretion follows this pattern? That first a rise, then a fall, and then again a second rise.
To avoid aneurysm. To avoid aneurysm.
Another reason?
To maintain the
balance.
In order to understand this, take an example. It will make you to understand easy. Suppose one day when you are returning from university to your house, along with you, you take 3-4 your friends with you to your house. And you ask your mother that we are all very hungry, give something to eat. Now, in order to give you immediately, what she will do, that whatever the things are available in the fridge or in the freezer, she will take it out and immediately give it to you. But this was not in a big quantity, so immediately finished. Then after this finishing, she will prepare some new things, but it will take some time, maybe 10 minutes, 15 minutes. And then after 10-15 minutes, when she will supply you the new food, that food will continue till you fill your stomachs complete. Similarly, here in our body, there is always some insulin kept stored in the beta cells. The moment the blood glucose rises, all the stored insulin will be first released, leading to an immediate rise in the insulin level. But this stored insulin, within some time, it will finish. And therefore, this insulin level, it will come down. But then, again, within next 5-10 minutes, all the ribosomes, all the endoplasmic reticulums, they all start working at a rapid rate, synthesizes new insulin, and now after this time, there will be again a second rise which will continue till the glucose level come down. So these two rises followed by a fall. This is first because of release of the stored insulin. Then as this storage finishes, the level comes towards the lower side, and then again a second rise because of increased production of the insulin now by the beta cell. So that's why the insulin secretion, whenever there will be an intake of food or hyperglycemia, it will follow this pattern. Okay? Okay. Now in your sheet, there is some detail also provided related to the insulin structure, that it is a double chain structure bonded by the disulfide linkages, molecular weight, all this and that. You can go through the sheet as well. At present, we will go through quickly about the disease which is related with this insulin, that is diabetes mellitus. A few things only. Diabetes mellitus, a very common condition in our society, is a condition characterized by hyperglycemia with failure of the body to use glucose as a fuel, as an energy source. Although there is hyperglycemia, but still body fails to utilize this glucose. And this failure of the body to utilize glucose is mainly because of insulin deficiency, so the glucose cannot transport it from the blood inside the cells. As a result, two important changes will take place. Number one, all the glucose which is there in the blood, it will reaches to the kidney, where some of it will be absorbed and some of it will be excreted in the urine. So a lot of glucose is wasted. Number two, as the cells are unable to use glucose for energy, therefore alternatively they will start mobilizing fat and using the fats as a source of energy.
Gluconeogenesis.
Yeah. The more the fats are used as a fuel or as an energy, the more will be the formation of the ketone bodies, and as such the body will go towards ketosis and it will result in a change of body pH towards acidic side, which is called ketoacidosis. Secondly, as more and more fats are mobilized from adipose tissues, the blood fat level will be very much increased. And this increase in the fat level, it will increase the viscosity of the blood, that is thickness of the blood, and therefore the fat particles, they start depositing in the blood vessels.
Atherosclerosis.
Which is called atherosclerosis. So this will result in two changes. Number one, hardness of the blood vessels, and number two, narrowing of the blood vessels. The blood vessels lose their elasticity and become hard, and number two, they become narrow. And this narrowing is particularly important in peripheral areas where already the blood supply is low. Now, if the blood vessels get very much narrowed, they cannot receive proper oxygen, and therefore the destructive changes will start, which is called gangrene formation. Necrosis of the tissues will take place. Similarly, the narrowing of the blood vessels and their hardness will result in an increase in blood pressure. As a result, many small vessels get ruptured either in the brain or in the eye or in the kidney. Similarly, narrowing of the blood vessels of the heart, coronary vessels, will result in inadequate supply of oxygen to the heart, leading to heart attacks. So diabetes is one of that disease which affects almost every system of our body. Major cause for renal failure, major cause for blindness, major cause for arthritis, major cause for other problems. So that's why diabetes is not a single problem, but it involves many systems of the body, and the basic thing is insulin deficiency. But sometimes it is not the insulin deficiency. Insulin is normally there, but the problem is at the receptor site of the cells, which is called insulin resistance. This is another reason. Sometimes there are our autoimmune system, it develops antibodies against our own beta cells, which will start killing the beta cells. So this is another reason. So there are many possible reasons, and now the genetic factor is said to be a very important factor in the diabetes. Yes. Which disease? Grapes. Autoimmune or antibodies can develop due to any reason, not necessarily because of Graves' disease or anything. Any mutation because of some viral infection or due to any reason, it can produce antibodies. Yes.
Genetic diabetes is that
I said genetic involvement is now said to be one of the important factors in contributing in diabetes. That's why it is common in families. Usually, members of one family, they have more chance of diabetes than the other family. So, if something is common in a family, it means it is transmitting through the genes.
It was just the reason.
Yeah, genetic.
The autoimmunity when it comes to the receptor lead to increase the insulin secretion.
Autoimmunity? No, it will decrease insulin. How increase? How decreasing? Because it is destroying the beta cells. What can happen? What I can understand your question is that if, for example, 30% of the beta cells are damaged by the antibodies, initially the body will try to compensate for the lost beta cells by increasing the workload on the remaining healthy cells. So initially the deficiency of the insulin will not be much because of the overwork by the other cells. But when the more and more cells are damaging and also some cells are damaged by the overwork as well, then ultimately you have to come on the insulin therapy.
Transplant of beta cells.
Transplant? Maybe possible transplant, but till now not any case of successful transplant. In the future, it is said that every tissue of the body that will be damaged, it will be removed and transplanted by a healthy tissue. But when it will happen, we don't know. Because till now, even the cases of renal transplant or liver transplant, the success rate is not very high.
Yes.
Because of many reasons.
Immunity.
Not necessarily that in every case there is a rejection there, because first the success depends upon the fact that the donor should be a blood relative.
The immunity.
Even if the blood relative, then you should to continue to give immunosuppressive drugs to the patient. And immunosuppression means that maybe the kidney or liver is functioning normally, but due to other infections the patient may die after 1 year or 2 years. So that's why it is said that the success rate is not very much high as it is expected. Maybe in the near future. Okay, now after these brief things, let's see what happened to this rat. If it is okay, then we will collect the blood sample. Now coming to the procedural part.